Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness.
Hey, Bhavna.
Hello, how are
Hi.
you?
Good. How are you?
Good. I'm so happy to see you. Today we
Oh,
have another Cindy doctor all the way from California here.
yeah, absolutely.
Yeah, how was your day? Tell me a little bit more about your day.
My day was actually not bad, and by the way, I am in New York.
Wait,
Yeah.
I'm sorry.
No,
I
no, no.
thought for some reason you were in
No,
California.
no, 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 not at all. So I'm right here in New York City, in Manhattan, and my day was quite busy actually. Even though I'm on consult service, there was a lot of consults today, and I got home and immediately had to just do some stuff around the house and then get on here. So I'm glad this is how I'm ending my day.
Why aren't we meeting? Why are we not going on for dinner?
We
Some
should, we should.
we
Let me know.
should plan something.
Let me know whenever you're free and we can do that.
Definitely, I would love that. I don't know why did I think that you're in California for some reason.
No, it's okay. I probably give the California vibe because I love warm weather. I would hate to continue living here, but New York City is New York City.
Where
Can't
where where
take.
are you originally from?
So I was actually born and raised in New Jersey. So originally from New Jersey, not too far. And then because of work, we moved to New York City. My husband actually moved to New York City before I did, and that's what drew me to the city. And now we're here.
Love that. You're married. You're too young to be married. What you doing?
No, I actually feel so old. It was funny because I had crossed 30 and my parents, I mean, I was dating my husband at the time, but my parents were like, it's time to get married. Let's go.
The typical brown parents.
Exactly, exactly.
Yeah, I just turned 26 a few months back, and my parents are like, "You're already old enough. You have to
Let's
start.
get going.
Yeah, get going. Come on, what you doing?"
That's really nice. But tell them that you will take your time to find the man that you want to be with.
They know that.
Yeah.
They know they're giving me my time, and they're very supportive
Oh,
that way. They're
that's really
very
nice.
sweet and
Yeah.
supportive, but they're parents at the end of the
Yeah.
day, and they're just worried. They're just being parents.
Yeah, exactly. But just convince them. Just be like, I promise you, I'll find the good guy that I need to be with, and you just gotta give me some time.
Yeah,
And I'm sure they'll know, and they'll be happy for you in the
yeah,
end.
definitely. They're very supportive. That's what I love. Like, they're very supportive. I love them for
Oh,
that.
yeah, that's really nice, and it's important. Do you have any siblings?
I do. I have a younger brother. He's in India.
Oh, so yeah, I could see why they're a little like, okay, you know what, let's
Hmm.
get her going, but I'm sure, things are gonna turn. Tell your brother to have your back and be like, you know what? No, I don't want her to leave just yet.
Yeah. Surprising enough, he did defend me a few times recently. So I'm like, okay. And because he's the type of brother, younger brother, that always gets me in trouble and will like play the blame game on me. Like, oh, she's at fault. But I was surprised to see that, oh, when it comes to like real issues and stuff, he's got my back.
That's
So I like that.
that's the best. And trust me, he doesn't want you to go anywhere, not too far from him. He wants to make sure he can continue doing what he was doing before,
Yeah.
getting you in trouble
Yeah.
out of love.
He does do that still.
Right. I can imagine.
You have any siblings?
Yes, I actually have a younger sister who's also married, and I luckily have a 2-month-old niece, and she is
Oh,
the cutest. And I'm so glad to be a Masi because it feels
yeah.
so great to, have her. Now I have another sibling, like
Yeah.
person that I can be a mother to. She always used to say, you're always a second mom to me, and now I have someone else to be a mom
Oh,
to.
that is so
It
cute.
is.
Do you
It's
have
so
any
cute.
kids of your own?
No, not yet.
You never know.
Yeah, I know. And actually, the whole family planning part, I just have to get my career to.
Yeah.
I just have to figure out like the last part of my career, and then
Yeah.
we can get going from there. So that's the only hard part of all of this.
This is the tricky part being a woman,
Yeah,
that
exactly.
at the peak of your career, you are at the peak of your family life, and you
Exactly.
want to start that, and that's beautiful, but you don't want to give on something that you're making out of your own life. So
Yeah, exactly. It's, I think the bigger part of all of this is like, fine, I have my career, I have my life, I have everything going, and then, you bring another life in this world and you want to be able to give them everything. So you need to be 100% dedicated towards that. And if you can manage both of them, then, it's better. Just so that, if they're going through things too emotionally, they'll see you and they would want to spend time with you. And then if you're not there, then it's hard for them too. So
yeah,
you want to think it out before you decide to take that
definitely.
step.
It's difficult. It's difficult
Yeah.
being a woman.
Yes, absolutely. It's definitely hard. And then even though my husband would be supportive, leaving
Right.
him to do everything is not enough. And then on top of that, your child
Yeah.
also wants a mom. Mom and dad both have to be there. They both have to be actively participating in the parenting.
I think that it's easier said than done, like,
Yeah.
oh, it's all on you. You can take a break, you can work from home.
Yeah.
But at the end of the day, when you look at them, just that it's not right, and you want to be there. You want to give your 100%.
Yeah, exactly
I
that.
feel that. But only beautiful things happening to you,
Thank
and
you.
I wish and pray it will only happen. So
Oh, thank you. I appreciate it. And so same to you. I mean, look at how far you've come along, and that's important as well. You want to be able to make sure you continue that, and
yeah,
it's nice to see how far you've come and how you're going to continue to grow. So that's nice.
thank you,
Of
thank you.
course.
That means a lot to me.
Oh, of course, of course.
Okay, let's get started
Sure,
with my first and my favorite question.
sure.
What is health and fitness according to you?
So health and fitness, although I have done a degree in exercise science and nutrition, and now I'm in medicine, my mom always tells me I am the worst patient, which is true. Doctors make the worst patients. But health and fitness for me, if I were to even apply it to myself, ideally would be a lifestyle where I can exercise, I could have a good diet, not eat out as much as I do now, and at least, have a good balanced diet that is full of nutrients. And then also at the same time, having a lifestyle that has stress reduction. So, a lot of the work stress that we have, be able to relieve that. Not only by having adventures and traveling the world, but also spending time with the loved ones you have and having that support system. And as far as fitness, being able to just work out and make sure that you have that balance of all kinds of things like strength training, cardio, being fit in the sense that you are physically in the shape to be able to make sure that you are also not only like looking okay on the inside, but also on the inside.
Yeah, you put it so beautifully, and you can tell that you come from an exercise background because you
Really.
had so much knowledge and you had so much to offer right now. Tell me how you started your journey in exercise physiology.
So, like surprisingly enough, I fell into having an exercise science and nutrition double major in undergrad after
Uh,
I found out that I don't want to do biochemistry. Even though I liked biochemistry,
right.
biochemistry was very intense. I remember sitting and saying that I have to take I forgot the name of the course, but it was basically an advanced physics class, which
Right.
was chemistry and physics combined together. And apart from like quantum physics, I was like, no, I cannot do physics anymore. I was okay with like the basic physics. I can't do more than that right now.
Yeah.
So that drove me into changing my major from biochemistry to exercise science and nutrition. And I actually just saw a lot of people that I knew that were doing exercise science. So I just picked it as a major, but I always knew I had an interest in nutrition because growing up in a South Asian family, my parents were always like, nutrition, nutrition,
Yeah.
nutrition. So that's how I got into nutrition. But yeah, I finished and I felt like I learned so much during that process.
Yeah.
Exercise physiology in itself, it's you would be surprised that your body, I mean, yeah, you have physiology, but in exercise, things change. And even though it's like a short amount of time, you can have acute changes, you can have chronic changes. So it's nice to see that, it's a great way of understanding your body and what happens under those kinds of conditions. And then as far as nutrition, it ties in when it comes to like fitness and someone who is trying to lose weight, for example. It's like you can't just do exercise, you can't just do nutrition. It comes together as a pair.
I know. It's so surprising that you mentioned about like the acute and the chronic changes. Like, especially we were talking about how difficult it is being a woman
Yeah.
in today's world. I have noticed that there are so many
Yeah.
changes that come across a woman's body as they're growing, or just everyday changes. Like one day I'm like super slimmy, and then I have like chicken biryani or chicken tikka at night, and then the next day I
You're
have like a
bloated.
few pounds. I'm bloated or something.
Yeah.
Also considering the hormonal changes that
Yeah.
a woman has to go through, it's so surprising to see those ups and downs and thinking,
Yeah.
is it normal? Am I the only one going through it? That psychology part also affecting you.
Yeah.
So tell me a little bit more about that. Like, how would you counsel a patient, or women with insecurities about that, which is
Yeah.
not their fault? How would you approach that
Approach that
aspect?
stuff.
Yeah.
Absolutely. So, it's interesting you mentioned that because actually, I'm not an endocrinologist, and I actually just came across the idea when I applied my knowledge in exercise science and
Right.
nutrition to medicine. And I came across the idea like during our menstrual periods, for example, we have those ups and downs and those hormones, and that also affects, and like
Definitely.
depending on which menstrual, cycle part you're in,
Mhm.
you can be gaining weight, you can be retaining fluid, and actually you have to also tailor your exercise regimens based on that as well, and also your nutrition. So in times of you're retaining water, you want to be able to have less salt, you want to be able to have higher fiber,
Right.
you don't want to like get constipated, and you want to be able to relieve that bloating, so you want to add foods that are going to decrease bloating but at the same time help you go to the bathroom easily. And then as far as the bloating aspect, you don't want to be eating, I mean, during PMS a lot of us are going to go to like the chips and the cookies and all of that, but if we can limit that, it actually helps us, and it also helps us hormonally in that aspect as well. And just like in terms of nutrition, exercise is the same way. So people who do a lot more aerobic exercise during their PMS period, they might feel like, I'm doing a lot of work, but why am I not losing this? And it's because of the fact that they're at that peak where they're about to get their period, so they need to be able to slow down on their exercise so that this way they can get the break that they need, because of course your body needs a break and they need that rest. So during that period, try to slow down and then pick up when you're towards the end of your period, because that's when the estrogen's going up, you're
Correct.
starting to have the kind of energy you need to be able to continue going. And that's what happens. And then also with progesterone, a lot of the weight gain happens because your body's preparing to try to have a child.
Mhm.
So now it's retaining all the nutrients you're eating. So a lot of it actually is good to see, because you get to apply it to your menstrual cycle. And then those that are postmenopausal, all the hormones are dropping now. So now you're seeing a lot of women who gain weight. And then they also say, why are we not losing our weight? And
Right.
it's because of the fact that they don't have the hormones that would help them during the changes, the fluctuations. So that's why everyone looks to, trying to do supplements. And now the big thing is Ozempic. But looking at all of that, we actually are altering our hormones then and there
Mhm.
too. Insulin plays a huge role when it comes to metabolism. Thyroid plays a huge role. A lot of women towards postmenopausal stages, they actually end up developing thyroid disease, just because of the way that eventually your body catches up, and then your the hormones change. So that's also a factor. And just, yeah, endocrinology all in itself is, not only does it apply in endocrinology, like
Yeah.
the exercise part of it, but nutrition. It's surprising how everything plays a role. For example, also in Hashimoto's, you're not supposed to be having a lot of gluten foods. So, you shouldn't be having a lot of those kinds of foods. You'll experience a lot of bloating. and you'll continue to have like your metabolism won't be as high because the thyroid is working harder to get the metabolism up, but because of the disease itself, it's not actually working. The antibodies just keep developing. So, yeah, it's actually more complicated than we think it is.
Definitely, yeah. Perfect timing. Like it feels like you mentioned Hashimoto's. I just have a patient sign in. I did an evaluation 2 weeks back, and she came in with arthritis, and we were talking about how her stomach has been so upset.
Oh my, yes.
Yeah. So it all makes sense. And then she has so much joint pain and arthritis, and she's very young,
Oh my,
thyroid, like you mentioned.
yeah,
So me being the desi that I am, I was suggesting her, you should like have a spoon of ghee for your joints, and we were
yeah.
talking about the digestion, and I also am doing like a little bit of Ayurveda reading, and I'm
Wow.
studying a little more about that.
Yeah.
So I was coming across a few like techniques and stuff. So I was telling her, talking about the diet aspect with her. But it was so interesting how you put it. Like it was like you were reading a whole book out of it. You mentioned every hormone, every nutrition part. That was beautiful.
Oh,
You seem so much into exercise and nutrition. Why'd you switch?
so I actually, when I first started, I wanted to be an exercise physiologist.
Right.
I actually started off working as an intern and a wellness specialist, and that was right after undergrad. And I applied my nutrition and my exercise science background by helping cardiac, pulmonary, and bariatric patients with rehab, and also bariatric patients to lose weight, because in order to go to for knee surgery, they want a lot of bariatric patients to lose that weight, because
Yeah.
again, what are we focused on? Habits, and the habitual the cycle that we get into is that we continue to eat, we continue to gain weight, but what does that do? That puts strain on our body, especially our knees. So a lot of bariatric patients, they end up getting knee replacements because they're having so much weight over time. And the good thing about losing weight when it comes to getting that elective surgery is that you have enough time to lose weight. And if you need to go through bariatric surgery, then you can do that, and then you can do your knee surgery. So this way, everything is being touched upon. But yeah, I came across that, and I don't know, during that time, something still was calling that I want to be a doctor. The Indian parent always telling you, yeah, be a doctor, be a doctor. But I had to figure it out for myself. I always knew I love science, and that's why, the science background. But
Yeah.
when I realized that I really want to help patients, and I want to be there as a physician, because they actually come to physicians, or doctors as a whole, whether it's a pharmacist, like for you in physical therapy, or any other doctors. I know that they're the Ayurveda, homeopathy back home. There's so much respect for doctors because of the knowledge that they carry. So I wanted to have that knowledge set and be able to help my patients, educate them, and hopefully get this cycle going where it's not only from me, but their generations, and they're able to help their grandparents, parents, themselves, their children, and generations to go. So hopefully I can make small change, and that was my reasoning to become a physician. But I still like the exercise science and nutrition, so I do time to time. I mean, I don't practice as a wellness specialist anymore, but in my patient encounters, like you were asking before, how do I educate my patients? I sit there and just explain to them, like, this is, if you do this, this is what's going to happen. I do recommend that they have a personal trainer that'll help them. And we do have something called health educators, health coaches, and I tell them, you should go to them, and they will keep you on track. You'll set goals, and then you'll be able to meet them. And if you fall short, then they'll get you back on track. And of course, I'm here. You can always come and talk to me. So that's how I get to play that role. But yeah, I mean, I'm hoping that it'll make some change.
Definitely, it is. It's already inspiring so many
Thank
people
you.
out there, including
Oh,
me.
that's really sweet of you. Thank you.
Yeah, and you get to do like the best of both worlds,
Yeah.
You get to educate them to start, to begin with, and you get to be their doctor also and see them through the whole process. So that's
Yeah.
really beautiful.
Yeah. I agree. I mean, to see that, I'm in residency now, and I started as a first year, and obviously in my third year now, in my last year. But we are PCPs, or primary care physicians, for all our patients.
Yeah.
So there's patients that I saw in my first year, and I've continued, and to see that progression, and I tell them now, I'm like, oh, I'm sorry, but I'm leaving. Oh, we're gonna connect you with another primary care physician, and they're like, oh my God, you helped us so much, and just to hear that, it's so rewarding. It makes you feel like you went in this field for a reason, and that purpose is being met now. So I like to hear that, and I'm gonna miss my patients.
Yeah, we all do that. Yeah,
Yeah.
it's the worst to discharge our, especially our favorite patients. We all have our favorite patients.
Yeah, yeah, the ones that come and they just cheer you up, and then there are those that also affect you, because you're just like, why am I encountering this person? Why is it that it's such a negative encounter? And initially that was very hard for me, but over time I realized these people are actually the ones that need the help the
Yeah,
most, because they're the ones suffering, and their suffering is resulting in their negativity.
right.
So there have been a lot of encounters where initially I was like, oh my God, why am I dealing with it this way? And over time, I finally, came to a conclusion that I have to be able to, one, obviously every patient's different, but
Yeah.
be able to understand and just read between the lines, see exactly what they needed at that moment. And being able to do that for them, and being able to connect with them, they will recognize and they'll appreciate it at the end of the day, and it'll make you feel that you've connected with them, and that was your aim. You want to be able to connect with them, so that this way you can get through to them.
Definitely. You mentioning the negative, it's funny because, during my internship, I came across, this was Manhattan. So, I came across a few patients. I did my internship, I think 5 months in Manhattan.
Okay.
And we had one patient that was being bounced around by therapist to
Oh,
therapist. And when she came in, and the senior therapist, she says, like, oh, like, don't entertain her, like, just, do whatever. And I'm like, what do you mean by, like, do whatever?
yeah,
uh, then they're like, oh, she's crazy, like, she'll come in with a million questions, and
yeah,
she's all over you, and she's gonna waste your time and everything, and she's at the end of the day, she's just going to complain and leave. So I'm like,
yeah,
okay, like, she's here and she is still attempting to be here, and
yeah,
if she's here, that means she's still in pain, so at least let me.
yeah.
And no other therapist would take her also.
That's
So
a
she
shame.
comes in
Yeah.
and she's like, I'm new to this country. I don't know how the insurance works. I
Oh
don't know
my.
what's going on with my knee, and I've been walking, but it's hurting. I just want someone to, like, explain what's going on. And I'm not saying that this was in a very, like, a soft tone, like I am speaking right now. She was
Yeah.
definitely very anxious. I wouldn't
Oh
say
my.
angry, but she was too anxious. She was like, I don't know what's going on, the insurance part, everything. And we've been practicing in New York.
Yeah.
So crazy.
Yeah.
It's so difficult. I don't know if how much you come across the insurances here,
Yeah.
but it's so difficult for us to understand, and the changing laws and rules and the co-pays and
Yeah.
all of that. So I was like, okay, let's, like, take a deep breath. We'll sit down, and I
Yeah.
explained to her. I first pulled out her chart and the anatomy. Luckily, we had those dummies and the
Um.
anatomy. Yeah.
Yeah.
So I brought that out. I was like, see, look, like, visualize. This is your ligament,
Oh
and
wow.
where the tear is. This is what the X-rays is showing. You have arthritic changes. Okay,
Yeah.
how normal looks like. This is how arthritis looks like. It's like, oh, this all makes sense. So what do I need to do?
Yeah.
He said that. I showed her, like, 3 exercises. We didn't do anything crazy because she was anyway anxious.
Yeah.
She goes, she came in next visit, no questions. She was like, I know my exercises, you just keep an eye on me and then tell me what to do next. She
Wow.
was a curious patient. She started after the third session. She said her knee pain is, like, it's getting better. Of course, it takes time. So she
Yeah.
was so happy, and she was a complete different person.
Yeah.
It's just about how you, sit down and understand that their negativity is not towards you
Yeah.
personally. It's
Yeah.
that they are going through, and
Yeah.
just to take a deep breath and just handle it that way.
Yeah. No, absolutely. And I agree with you. You know, you might realize that just speaking to them, you get to figure out exactly what it is that's making them anxious. And just pinpointing that, firstly, that actually does 50 to 60% of the work, because their
Right.
anxiety is what's driving a lot of this. And, you know, once you bring that down, then they're all ears and they're willing to listen to you, and you get to connect with them because now she trusts you. You know, now she knows that if there's any questions she has, you will go in depth and you'll be able to explain it to her. And she's gained that trust. And now she's like, you know what? I believe that she knows what she's doing, and I'll continue doing that. And that is the bigger part in all of this. You know, we are able to practice as healthcare professionals, but at the end, we're making an impact because these are relationships that these patients are going to have. And internal medicine happens to be that field where you start if you're working in the hospital, yes, you know, it's a shorter time, but in the outpatient setting, you have these relationships. These are patients that are going to be coming in through the door every so often, whether it's every 3 months, 6 months, 9 months, 1 year, every even 1 year at a time. If they come, they know that they are going to be taken care of because you will take care of them. And that is important to them because they need someone, you know, they need that expert, that compassionate person who is sitting there to listen but also give that advice that they need. And that just does majority of the work, because once they feel that you're there for them, then they're willing to listen. And there are still some that you still have to, you know, break that wall that they have created, and you slowly can do that and you chip it away slowly. And once they are able to open that up, the wall comes falling down, and then they're able to talk to you and they'll connect with you. So it does take time for some patients, but for a lot of patients, it's that one encounter that is enough for them, and they're just, you know, you win them over, and that in itself is treatment, you know, because you want to be able to get through to them. So it's helpful when it comes to that.
Yeah, patient education and patient understanding patient psychology actually plays a huge role.
Yeah. Yeah, absolutely. And I'm so glad that you were able to do that for her, you know, because that she just that needed that one person that actually cares, that one therapist, that one doctor, you know. So
I
great job, by the way.
thank you. I finished my internship and I got to know that because I finished my internship and then I got a job as soon as, you know, because it's not like, oh, 2 week notice period, nothing, because it was
Yeah.
an internship sort of situation. So I left the Monday and then I got to know, I was talking to my colleague and she was like, you know, she stopped coming, and she was like asking, the thing is we cannot give, due to HIPAA reasons or whatever, like we cannot
Yeah.
give the phone numbers or personal contact information. But I did tell her, like, share my email or like my
Mm.
social media. I'd be more than happy to connect with her. But
Oh.
yeah, she stopped coming. She was like, I'm not going to see anyone. So yeah, you
I hope
can.
she finds you.
Yeah, I know she did. She did text
Oh,
me. She's doing good. We did a
great.
motivation program,
Oh, this is
and she continued doing that. She's back to normal with little bit of like knee pain with the climate change. But yeah, other than that, she's doing good.
that's amazing. I mean, that's, you know, look at that. You helped her get from point one, and now she's all the way, you know, at the end, and then that's what you need. I was gonna say to you, you mentioned about insurance. It's interesting because a lot of us, you know, we want our patients to get into physical therapy, and they're like, no, we don't know how many sessions our insurance
Yeah.
is gonna have, and you have to just go through all of that to make sure sessions are covered. And you have to be able to help them out. I mean, I have had patients who've had knee pain or back pain, and their sessions they only have like 5 or 6, and you know that's not enough. But a lot of the therapists, especially at Montefiore that we talk to, we always, you know, send them a message. We use Epic as our um, um,
Brilliant.
the electric medical record, so we're able to just chat them and let them know, oh, you know, this patient, we want to be able to have them come in, so they already know that this patient's going to be coming. And they're so sweet that they're able to give them extra exercises
Yeah.
in the amount of time that they have, so that this way they're just like teaching, and they're like, you know, at your next session we'll be able to make sure we'll do a little extra. And they're still helping out because they are doing a little more, that extra mile, and it means a lot to the patients and helps them too in the
Definitely.
end. Yeah, gets them that rehabilitation back, and that's important.
We are fighting every single day with the insurance companies because
Yeah,
there are people who are not physical therapists who take decisions for patients
yeah.
that don't understand what the patients are going through.
Oh
So
my.
I'm
Yeah,
upset with the fact that I'm and I've been talking to so many people. Like I was talking to a person from California, and he said like they're doing their job at the end of the
Yeah,
day. So I'm not upset with the
that's true.
people who are doing their job, but I'm upset with the
Yeah,
system that
yeah,
you're approving 10 visits based on 1 year, just 10 visits per body part. 10 visits is nothing. Like
yeah,
that, it's done in 3 week, in 4 week. That's not even a
mhm,
month.
yeah,
And post surgery, we at least need, like for example, with arthritis patients and all, it's lifelong, and you
yeah,
have to keep maintaining. So we need the maintenance. Like there has to be a little more changes, I believe,
yeah,
and they need to be aware of the fact that um, the healthcare system can do better if
yeah,
we make a few changes here and there and we take a few steps.
yeah. No, you make a very good point. You know that you being a patient advocate would be so important because it's important to see that from a healthcare perspective. They usually see it obviously from the insurance. You know, they want to be able to make sure that they're making money and
Yeah,
they're doing what they need to do, and obviously the agents there they're also helping to make sure of that. But it's sad because the help that we want to give to patients we're unable to do so just because healthcare is a business, you know, and that all aspect of it, yeah, I mean someone has to make the money, right? But at the same time I think that if there was a happy medium where they would understand, okay, this is the need and this is what it's going to cost us, you know, because obviously resources are not scarce, but you want to be able to come to that happy medium where you're still able to give the care that you have, or you can give, whether you know it's through therapy or other modalities in conjunction to therapy, but at the same time manage the costs. So I
yeah,
think I think it has to have
the
some, I
balance.
guess, awareness. Someone needs to be there. I know, like for insurance companies, we do something called peer to peer, which is
Mm-hmm.
another physician who is having that say, you know, okay, I understand from a medical perspective, but maybe you know, physical therapists, if they're able to also play a role and be able to have a voice, they'll be able to make that difference, and a lot of our patients could get more sessions.
No, we do
I know,
peer to peer almost
yeah.
every day.
Yeah, absolutely. I wish there was a physical therapy perspective to understand, you know, okay, this is what it is. I know the PMNR doctors, they are able to kind of help us figure that out, but it's still very hard because, you know, they don't know how long the sessions would be. Like, for example, a patient who comes in after surgery, we don't know if the 20 sessions that some insurances cover are going to be enough, like you were saying, you know, that's such a short amount of time. If you do even 3 sessions a week, then that's no more than you know, I guess, yeah, 21. So like that's
Yeah.
less than 8 weeks. So that's not something that's enough for a patient. You know, at least 12 weeks should be suffice. So if someone could just bring that up, it'll be important.
I feel like they have to be more specific when, personally
Yeah,
speaking, with like physical therapy and other allied services.
yeah,
It has to be more specific to the condition and
yeah,
not just specific to like the insurance plan.
yeah,
That's the difference.
yeah,
So if they're specific to the condition, they will realize that okay, if the patient has arthritis, that's going to be with the patient forever.
yeah,
If a patient has a knee surgery, then you have to give like 6 to 8 months. That's the rehab time to give. So I understand taking away a month or two so we fast the process and we can switch them to home or gym
yeah,
exercises. Then not, giving them just like your plan says 10 visits per year. That
yeah.
doesn't quite make sense to me.
Yeah, no, no, you're absolutely right. I mean, my father-in-law, he went through knee surgery, and his first knee surgery went really well, knock on wood. But the second one, he had a little bit of a complication. His healing was prolonged
Yeah.
compared to the first knee. And in that kind of situation, you want to be able to have a little bit more care, and having those limited number of sessions makes it very hard for the patient because they feel like, you know, now what are we going to do? Are we going to have to pay out of pocket, or
Right.
are we, you know, there nothing is going to be covered, or you know, what is going to be the end result? And you don't want to leave a patient like that because, again, like we were saying, mental, like the anxiety, the mental status is a lot of the healing process. You bring on a little bit of stress, it impacts healing, and you don't want that.
Yeah, and it's so difficult because they just start connecting with us a few sessions, and then we're doing good. We know about everyone's family life, personal life, love life, everything, and then you get to know we have to stop therapy because of insurance.
Yeah.
So
Yeah. I guess the idea also is that they will learn their exercise and they do it at home. But we well know that,
mhm,
supervised, I mean, look at even weight loss, for example.
right,
A lot of people need someone who is motivating them, a personal trainer who is helping them reach their goals. And if you have therapy, you're learning how to do the exercises with someone, yes, and you can do some at home. But at the same time, when it's supervised, you feel comfortable. You know that you are going to be told like, oh, you're maybe doing this wrong, let's fix it a little bit. Being able to get that feedback is important, and just being able to understand that the exercises that you're doing,
mhm,
what impact could it have if you were to change a little bit, or tweak it a little bit, and only an expert can give that to you. So being able to do that at home, yeah, you can watch maybe some YouTube videos or something on TV, but with someone, a person, it's important. They'll be able to talk back to you, and that's what you need, that conversation.
no, definitely.
Yeah.
I started doing basic yoga at home,
Yeah.
watching Netflix, not even like YouTube, like Netflix, basic
Wow.
yoga, and I strained my back that day.
Oh my goodness.
I I was in pain for like a whole week. So I understand the difference between like the personal touch and
Yeah.
actually going to a class to do the yoga,
Yeah.
that or just watching a video and doing it. So
No.
that's two different things. And I know we live in a world with telehealth, and we're making the
Yeah.
switch, but it's still important to know that at least for a while you do need to have someone to look over you.
Yeah, no, it's so true. I mean, I like like we were saying, televisits here and there, just because, if a patient really needs to get to you and like they weren't able to get an appointment, okay, fine. That's like something urgent. But even for that, like there's patients who they want the same day visit for example, a cold. Now I can't have them come in through the door and do a
Yeah.
swab. They have to physically be here. And in order for that, they should have had a visit. And then, for example, I had a patient who had knee pain. And I was like, well, I'm glad that we're connecting, but I can't examine you. I can't tell you if that knee pain is, maybe just something that you're developing, like osteoarthritis, or did you tear a ligament or a meniscus? So all of that has to be put into perspective. So, yeah, well, telehealth has its own benefits, but at the same time, that person to person kind of interactions important. It's surprising because a lot of the older generations appreciate that, and all the younger generations are like, nah, we don't want to go in. We'll just do a televisit. And it's, why are physicians? They're physically doing something, which is physically examining you. And like physical therapy, it's a physical therapist that's actually doing therapy on you. So, or, you're doing it passively, but at the same time, it's an active moment. So
Yeah.
it's important that you have that interaction.
I like the fact that you mentioned the hybrid thing, like because that makes more sense
Yeah.
than just doing a whole telehealth thing or a whole physical thing. Like,
Yeah.
but again, the insurance is so tricky here. Just for telehealth, I know insurances that allow only one visit of telehealth
Oh, yeah.
throughout. So
Yeah.
I'm like, we just got one, and it's called the initial evaluation. I mean, of course, for evaluation, I want the person to be physically present, but the rest progress, like I can try to do telehealth and do exercises. So I did a few sessions,
Yeah.
but again, so tricky because the insurance will not allow telehealth physical therapy.
Yeah. Yeah. It's hard. It gets tricky to be able to figure out exactly what would be the right uh, visit for the patient. But at the same time, I feel like when it comes to these kinds of things, to be in person is better than not. And you also get to see, like when your patient is talking to you, you can kind of pick up, okay, they're not comfortable. telehealth, yeah, you might be able to pick up some expressions, but when someone is physically in front of you, you're able to see, okay, they're in discomfort, if they're having pain, or if you're telling them a treatment plan and they might not agree with it. You can sense that, and you can ask, oh, I noticed that you might not be comfortable. What is it? And you can open up, and you can actually have that moment to, again, connect with them and understand exactly what it is that's causing that hesitation.
Definitely.
Yeah.
Oh, I loved it. I loved how we just swooped through the topics.
Yeah.
Such important topics that we touched.
It,
Really,
it is. It is.
really fun to talk about those things. Yeah.
Yeah.
Talking about like fun things, I noticed that you're into fashion and everything. Tell me a little bit more about that.
Sure, sure. So, I actually got, growing up, I was always fond of fashion. Actually, I was very spoiled growing up. My mom, the way that she dressed me up, everything was matching. If I wore a red dress, my shoes, they were red. My bow that I had in my hair was red. So she spoiled me from the get-go, but I learned my ways through her. She's really not into makeup as much, but I was
Right.
finally able to get into makeup, just being, a girl.
Yeah.
So I got into that, but that actually helped me decide that I wanted to do a little bit of modeling. And my dad, he also, growing up, I was very quiet. I talked to people who I enjoyed talking to, but I was very quiet when it came to social environments. And I actually am surprisingly an extrovert, but for some reason, in social settings, I can be introverted. So he noticed that, and he was like, you know what, let's get her into modeling school. So
Yeah.
I got into modeling school, and then after that, I just continued doing some fashion. I liked, dressing up, putting my outfits together, and then I got into pageants. But yeah, I don't know, somewhere deep down, I have that interest, and it's interesting because I have come across a lot of patients who actually say, oh, we dress up, we might not have the time to necessarily do something health related, but
Yeah.
our dressing sense, or like, getting our eyebrows done, or getting our, lashes, getting our nails done, is that relaxation time that we have. We can go and relax, and us looking good, it brings a happy moment in our lives. So it's good to see that actually is part of healing. You get to see patients getting
Yeah.
interested in things that they like as well. So I am hoping, I mean, I don't dress up when I go to work, just because I also want to be taken seriously. And it's interesting because I was just having this conversation with someone about how, when we were talking about female physicians or healthcare professionals, we have to make sure that we are setting a example, and that example is very important. So if I, go with a lot of makeup on, I don't want a male patient to say, oh yeah, she's just, doctor model, and we won't take her seriously. Or like another female saying to me like, oh, like, we don't know if we could take her seriously because she's so focused on her looks. How do we know that she has the knowledge? So a lot of it, I do dress down when it comes to work, but outside I still like to do that stuff, and I'm still dressing up, putting makeup on, doing a little bit of fashion here and there. But yeah, that it totally, depends on the environment that I'm in, but I definitely still have those interests.
I love that you put the your personal interest of fashion in how the patients, how you can make the patient feel so confident in their own skin, and so confident to go try fashion out, try the eyelashes and everything. It's so important for because when you're a doctor, I've realized that you're not just a therapist, you're not just a doctor, you're also their
Yeah,
companion. Like in
yeah,
during the time they're there, they're
yeah,
sharing their pain,
yeah,
which is they're being vulnerable, which is so important to
yeah,
understand. And us, however bad your day is, you have to be present for them, you have to be confident for them, you have to be
yeah,
like you said, and that happens only when you are taken seriously.
yeah,
and and it's such a sad world that we live in, that yet that if you're presenting your own self in the way you are, it's still there are certain norms to it,
yeah,
that okay, if you're a doctor, if you're a female doctor, this is how you should look, this is how you should
yeah,
dress, your hair has to be this. So
Mhm.
I don't like that now, but
Yeah.
it's the society and we're trying to break it or change it or
Yeah.
trying to fit in.
I hope. I mean, I know actually, surprisingly, there are a lot more physicians that do like fashion, and I do get to see that. And then there are people who come in with their like different shoes. Like for example, they're wearing a different colored shoe, or matching it with their blouses or something. So it's good to see that. I still have to find my comfort when it comes to fashion and bringing it into medicine, but hopefully I'll be able to gain that confidence to be able to pull off an outfit that I would also wear outside, that I can wear in the hospital as well.
I I don't know about outfits. I play with jewelry. I think
That's actually nice. Yeah.
yeah.
Yeah. You're
I
the
like
different styles you can do,
yeah.
and yeah, that helps. It's still expressing yourself in some way.
Yeah, definitely. Yeah.
Yeah.
My patients enjoy that. They're like, oh, you look good in this earrings today. So
Yeah.
yeah.
And it sparks a conversation too. You are
Mhm.
able to connect with them on some level. They might like something, or they might have something similar, and they were like, "Oh yeah, that reminds us of something that we had,"
Yeah.
and that just brings you a little closer, because what is medicine? It's just that humanistic touch. You
Yeah.
need that human ability to connect, and that's what's important.
Definitely.
Yeah.
Who has been your role model growing up?
So, a lot of people would say their mother, which yes, my mother has been, but actually, it was my grandmother, my Nani Ji, my maternal grandmother, and that's because that woman has been through many generations. But as she has gone along, she has also modified herself, and she's able to, of course, there's things in here like we have our morals and values. In Hindi, say sanskar, that we have to be able to meet or learn, and take them forward. But I know my grandmother. She was always she was always asking. She's like, "Do you like any boys at school?" And I'm like, "What? Like, why are you asking me?" So just to see that, I was
Oh,
able to connect with. Yeah, she's a really chill nanny,
yeah.
and to be able to see that, and then she connected with me. It was nice to see that they still want to develop a friendship.
Yeah.
Even though she's my nanny, I have to make sure I respect her. She still wanted me to be open with her, and my mom was very similar too. But it was, I don't know, some way, I had some fear, I guess, from my mom, because I didn't necessarily want to share everything with her and then feel like, oh my god, she's gonna judge me. She's my mom. Even though I know, like deep down, she wouldn't. Still that little bit of fear, maybe the respect I had for her. But my grandmother, on the other hand, I was open with her. She was one of my best friends growing up. I shared everything with her. And till this day, I mean, now that I'm married and I have my own life, she always tells me, she's like, Priyanka, I miss you. I miss the fact that we had that relationship where we shared everything with each other. She would share her life, I would share with my life. And she was I when I first started dating my husband, who's my husband now, she was one of the first few people that knew about him, and she would ask me like, "Oh, how is he?" and "What's going on? Like, tell me more." And
Yeah.
she knew about him before my mom knew, so that's how I knew that she was my role model, and she was the one person that I can share everything to. And all of that, she also was very responsible. She came from India, so she had a lot of businesses there, and she ran her own household. She was still independent. She still respected my grandfather, who was the breadwinner, but at the same time, she was independent. She had her own opinions. She was able to voice whatever she had to, but somehow she still was that ideal. Oh, she was able to keep families together, and being that ideal person, it just made me realize that I would want to be like her. I want to be that superwoman who can do everything under the sun and still be this great inspiration.
Oh my God. She sounds so cute.
She is.
I know. How do these women do
I have
it?
no idea. It's the previous generations that knew how to handle it all.
Yeah. And they
Yeah.
did it. They did such a good job at it.
Yeah.
Like
And with a smile on their face. Never
with the
never a
smile.
frown
Yeah.
at all. And even if they cried, they would never show it to us. They were, able to keep that going for us. They wanted to show how strong they were so we can remain strong. And, to be able to see that, it's just very inspirational.
Yeah, definitely.
Yeah.
I love the story. I really feel like coming and meeting your nanny right now.
You should. She'll be happy to meet you.
I'm actually in Jersey.
Really?
Yeah.
Awesome. Yeah. So my grandparents, so my Nanaji and my Nanaji, they're in New Jersey. They actually don't live too far from my parents. So my parents are in Jersey as well. And they're about 10 minutes. So I remember right after I graduated from college, I used to always be with my nanny, and my mom would be like, "Where are you, Priyanka?" And I'd be like, "Oh, with nanny." And she's like, "You're always there." And then sometimes my mom would cook at home, and she cooked every day. So it's not like I had any leftovers. I used to have fresh food every day. But if I stayed with my nanny, if I was gone for that evening, I would be coming home after like 10, 11. I would eat all the food my nanny would make. And then my mom would be like, "Oh, by the way, Priyanka, I have food for you on the dinner table." And I'd be like, "Oh, Mom, I'll eat it tomorrow." And she's like, "You don't eat leftovers. What are you talking about? You ate at Nani's, didn't you?" So my mom always knew, but that was because I would not leave my Nani's house.
I love that. She sounds such a typical Sindhi nanny. I love that. I miss that.
She is. And then it's funny because we're Sindhi, so she always is like, don't catch on the bad parts of the Sindhi culture, always the good parts. So she was always teaching us that. And it was like very nice. Like she was like, you should save your money, but at the same time spend it so that you enjoy your life. And that was the most important part.
I think this is a myth that
Really?
Sindhis are conjuice.
Yeah, it is. That's a lot of people think that we are, but we just like to save our money.
I mean, of course, because you have to think about like business and stuff and for business people.
Yeah.
But Sindhis are not conjuice. Sindhis are like the most wholehearted, whole sharing, people. That's what I know about Sindhis.
Yeah, absolutely. And that's what I liked because I finally was able to learn that. I mean, I still have yet to learn how to save money, but at the same time, I live my life, and it is all because of my grandparents. They were like, you have fun.
Oh my God. Right now, I miss my koki. I mean,
really? I love koki and then with chai, and well, remember I was telling you that there are people from Sindh in our program. So my best friend in residency, her name is Sonia.
Right.
And she has a son, and it's so funny the story that she was telling me. She's like, I give him a lot of Sindhi food, and he always says koki chai, and I'm like, that was a staple for us growing up. Like that's all we ate, koki chai.
Yeah.
And then sometimes my mom would make parathe, and I would eat papad with it. Everything had to have papad in it, and that was it. That's the only way we would eat our food.
Of course.
Exactly.
We should make a reel out of this.
We should.
Of course, we like papad.
Of course. And then like dal pakwan, my nani, even my mom, like we were just talking about it a couple of days ago. Till this day, my nani makes the best dal pakwan.
Really?
And no one else in our family can make it like her. And I want to be able to learn how to make it, but I don't think I'll even I don't even think I'll match what my mom could make, let alone, so forget what my nani made. My nani makes amazing food.
Tell me, how do these women, early morning breakfast, make dal pakwan in 10 minutes?
I have no idea. I don't know. And even like till this day, my nani can make 50 parathas or like rotis 5 minutes. And I'm like, how do you do that? It takes me a half an hour. We used to get HelloFresh, my husband and I, and the recipes on the bottom say like 30, make it in 35 minutes or 30 minutes. And I take like an hour, 15 minutes. I'm taking so long in the kitchen. And he's like, Priyanka, I'm dying of hunger. And then he can't help himself get involved. So then he starts coming to help me. And I'm like, what the heck? I want to do this on my own. I want to prove to you that I can cook. So
I haven't had I haven't made paratha or koki for myself. It's such a long process.
Yeah, it is. Just watching, I remember watching my nani. I mean, she did it very quickly, but just making it and then like cutting the lines that you have to do for koki or even paratha, like you have to add whatever the filling that you want to put in and then like roll it up again and then go ahead and roll it. It's just it's such a process
Yes.
that it will take a master to do, and I don't think I'm even close to a master.
Me either.
Yeah,
My rotis and parathas come from the
the
Indian,
store.
the Patel brothers. That's it.
That's exactly what it is. It's funny because my mom always tells me that either I can do that, pick up rotis there, or you know the roti maker? It's like this big machine. It
Yeah,
costs like $1,000, and I was like,
yeah.
Mom, first of all, I'm not spending $1,000 on a machine that I don't even know where I'm gonna place. But that machine is gonna take me forever to even figure out how to use it.
You're talking about the dome thing or like the roti maker?
Yeah, there's like a big roti maker. It has even a tray where like it pops out of. It's
Oh,
it's actually really big. Yeah, and I
it's a
mean,
very new one.
yes, yes, yes. And it would make sense in a restaurant, but at home, I know some people that have it, and my mom's friends. But I'm like, I don't even know. I don't even have the space for it in my apartment.
No, definitely. We're in Manhattan. We no,
We cannot.
we
There's
cannot
no room.
afford it. We cannot afford to give that much space to a roti maker.
Yeah, agreed.
Some-
But yeah.
Something that you would tell your 18-year-old self.
My 18-year-old self. I think I would tell my 18-year-old self that trust people, but also try to read them well. And the reason for that is because along the way, as anyone would, you know, you meet people and you something happens, you feel betrayed, and you get hurt in the end. And I've you know had that happen to me so many times that I feel like if I just told my 18-year-old self not to be so optimistic and be real and be able to pick up on things, pick up on the fact that a person's treating you a certain way, and be able to learn from that and move on so that you can actually meet the right people. I feel like now that I have the friendships that I have, they're close only because I've seen those friendships. Those friendships that had to go are gone now, and the friendships that stayed, they stayed. So I just wish I knew that a little earlier in life than later, but so in the end, it still worked out.
Yeah, it's a process.
Yeah,
Yeah,
for sure, for sure.
yeah, definitely. What is one piece of advice that you would give to everyone who's watching tonight?
I would say do what you want to do in terms of your career, your life. So for me, I wanted to become a physician. For Bhavna, she wanted to become a physical therapist, but figure out what it is that you like and definitely go forward with that goal and become that person that you want to become. And have a good professional life, have a good personal life, and if you are happy in your career, a lot of it is going to just make your life easy. And if you choose the career path that you want, you'll be, I feel, happier. So I feel like, listen to your heart, do what you think that is good for you.
I love that. That was beautiful.
Thank
Thank
you.
you so much, Priyanka, for
Of
taking the
course, of
time
course.
today and having this lovely conversation and making it feel so
Of
homey and
course.
close to my heart because
Oh,
you spoke about your nani and like the Sindhi culture. That was so sweet of you to share
oh,
on a platform. And definitely, you're not an introvert. You are a beautiful extrovert
oh,
doctor,
oh, thank you.
and I love to hear your story. Thank you so
Of
much.
course, Bhavna, thank you so much. You're just as beautiful, and I'm so glad that we've met. And hopefully, this is just the beginning, and we get to foster a beautiful relationship.
Definitely. You're here in New York, so in my mind, I thought you were in California, but this is so much more easier. I don't
Yes,
have to catch a plane and come to you.
exactly. Now you just walk to me.
Yeah, I'm just gonna walk, just take the train.
Yeah, that too. Whatever it is, we'll meet soon.
Definitely. Sounds good. Have a lovely
Thank
night. Good night.
you. You too. Good night. Bye. Bye, everyone.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.